When you throw away money on wasted electricity, you're throwing away everything you could have bought with it. Saving energy saves you money. Learn more at EnergySavers.gov.
Welcome to This Week with Sheriff Dave Phelan, a weekly program on LSN Television, Channel 9, Time Warner, right here in Lancaster. And we're also carried by a number of radio affiliates here in Lancaster and beyond. Do appreciate you, the viewers and listeners that join us each and every week. And certainly I would be remiss if I didn't thank the folks here at Fairfield Christian Academy, the students that actually produce and put this program together with absolutely no cost to the Sheriff's Office. And it gives the Sheriff's Office an opportunity to share things going on within the Sheriff's Office. We have a lot of different people that come in each and every week, not only from the Sheriff's Office, but community leaders throughout Fairfield County. This week, back by popular demand, is Cathy Mathias. Good to see you, Cathy. Cathy is our nurse within the jail, and we had a great conversation last week. For the folks that may have missed last week's program, why don't you just give us a little bit about what you do and about how the medical program works at Fairfield, at our jail?
Well, when an inmate is booked into the jail, and we call them inmates as soon as they arrive. They're not inmates until they're booked into our jail.
Okay.
They are told a process of how to contact the medical department right at the booking, so that if they have any medical issues that are concerns, they can contact us immediately upon arrival and let us know what their needs are.
So there's a personal history questionnaire kind of goes in, it lets them know. And now, do you get that typically?
No.
Okay.
Now, it's a process. They'll have to fill out paperwork. It's a sick call slip.
Okay.
That's put in my mailbox, and then I can go and find the person and find out what the issues are. That medical questionnaire, then I can get off the computer when I go to talk to that person to find out what they've said. You know, because sometimes they forget information. They're nervous when they're booked in, because everybody doesn't set out to be arrested the day they're arrested. So sometimes they're a nervous wreck when they come in there.
Yeah, they don't have their meds, do they?
No, they don't,
okay.
And they forget details, you know, because some of them are so upset because they've been arrested in the first place that when we ask them personal questions like allergies and things like that, they don't take time to think about what they should be telling us about their own medical history, and sometimes they forget to tell us things, so I always go back over it with them.
Do you have some prisoners that actually are not sick, but they go ahead and put in a sick form just because they want some attention or because they just want to be able to get taken out of the cell, somebody to talk to and listen to? Does that happen now and then?
Yes, but we still talk to them.
Okay.
Because just by talking to them, there might be something that comes up that does need to be addressed. And, you know, like I said last week, anxiety.
Okay.
You know, and we need to reassure them that their feelings are normal and that they will pass. And that if they don't, that we can still have them see the doctor and have an assessment and find out if, you know, he believes they really need help with medication.
And probably a lot of the prisoners have some mental health issues beyond physical health, right?
Yes, we have a lot of mental health patients at the jail. I mean, I hate to say that, but Fairfield County has a lot of people in jail, you know, that come into the jail population that haven't had mental health issues addressed because they can't afford to go to mental health services in the community. Mm-hmm. That's one thing Fairfield County could probably do as a county, is put more funding into mental health, because people are not being treated, the public is not being treated like they need to be.
Right.
And therefore, when they get to jail, we find some of the crimes they committed may have been because they have mental illness.
Right.
And so their mind is not correct, and so they're not making correct decisions in the things that they do, and sometimes they're arrested for things that they shouldn't even be arrested for had they had their mental health issues addressed.
Now, if you don't mind talking about it, this last year, you had a situation where you almost died.
Yes.
From some complications with pneumonia or something like that. And I can remember going down, and for our viewers and listeners, your husband's a fire chief, and we were at the hospital at Fairfield Medical in the intensive care, and you were being transferred to Columbus. And at that time, it was real questionable as whether you were going to pull out of it. And you don't have a lot of recollection about those days, do you?
No, I don't remember until I woke up 2 weeks later.
And I guess the question I would have is, being always on being the healthcare provider all these years, helping people in the jail, talking to people, and maybe people that had been in your situation, maybe were coming out of it or maybe becoming ill. How does that kind of change your viewpoint of things? Because I think that if it was me and I was at a near-death experience, it might kind of change the way I was kind of related to some folks.
Well, I feel like I've always had compassion for people to start with. I mean, just as a person myself, as a nurse myself. But I think how this affected me, because I was on that ventilator for 2 weeks and then in the hospital for 3 more trying to get to go home.
Right.
And I think that it gave me the ability to see that people need to slow down when they're in the medical positions.
Right.
I think sometimes that because of the volume of people that we see in the practice, that we are in a hurry sometimes to, what's your situation, here's how to address it, okay, bye. I mean,
right, because you got a lot of people coming in and out.
But that's in all the doctor's offices too.
Right.
That's in most doctor's offices that you would go to see a private physician. What I learned is that we need to take time as medical professionals to listen to the people and slow ourselves down so that we hear everything they want to tell us, not just address one issue.
Okay.
Because sometimes it takes time for people. You need to stay with that person so that if they can think things through, that though they may have an ear infection or they may have a sore throat, there may be something else they need to share with the medical person.
Right.
And I think we just need to slow ourselves down a little bit and give people more time to think while they're sitting with us, so that we can help them with more than one thing if that's necessary.
That's very interesting. What would you say, Cathy, is the biggest challenge that you face as the jail nurse, or maybe as our entire medical staff faces within the Fairfield County Jail? And there's probably a host of them, but maybe give me some highlights.
Okay, one of the issues that I think is the hardest for me to convey to inmates is their family.
Okay.
Because there is just some kind of misconception about being in jail. I have a lot of parents that call me and want to tell me what I need to do with their adult child.
Yeah, we get those calls. I get those in my office.
Yes, and so what we try to do is work with the parents and help them to understand that we have to go by HIPAA regulations. Once a person becomes an adult, they're in charge of themselves. A lot of parents don't understand that.
So that medical information, that's between you and the doctor and the patient. That's
Right.
not for me. That's not for the parent. That's not
Right.
for other people, is it?
Not unless that adult child wants their parent to know that information. You know, and it's a very fine line.
Right.
And it's very hard on parents.
Mm-hmm.
It's very hard because they call up and they want to know the condition of their adult child, no matter whether they're 18 or 45.
Right.
That's their child.
Right.
And they feel that they have the right to know information about them. And it's difficult for us because we just can't tell that. I mean, we have rules and regulations that we have to go by. And we can't violate those for the parent.
And for the viewers and listeners that may not be aware, what does the HIPAA regulation say? What does that mean?
Well, it's a Protected Health Information Act.
Okay.
Okay. So if the adult inmate, will say they're 35 years old, their mom calls and says, I need you to tell me what medication they're on. I cannot, by the HIPAA law,
Right.
Protective Act, tell her that. But I can go and ask the person that she's requesting information on, which has to be a relative of hers.
Right.
I can say, do you want me to, would you sign a release of information so that I can speak with your mother about your medications? And they'll either sign it or not. So that's how that works. We just can't go around and tell people's personal business to anybody. You're just not allowed to do that.
You know what has surprised me, Cathy, over the years is many people that we have seen in our jail, and Dr. Voyne, you do a good job, but the fact that I really receive very few complaints, and we have, and it seems to really go pretty well. I mean, you know, we don't have prisoners pass away from lack of medical care while they're in their jail. And I think that's one of the reasons parents call and they're concerned. You know, my son, has seizures. My son, he's been on this medication. I'm worried that, you know, something's going to happen bad in jail because nobody understands his history or background. So I think that really speaks volumes about the job you guys have done, because really I receive very few complaints, and we've had very few, if any, instances where we've had a tragedy while people were in our care.
Right. Well, one of the things, like you said about a parent calling up with seizures and stuff like this, we take information.
Right.
We'll take it from them.
Right. You want to know that.
We can't discuss it.
Right.
And, you know, one of the things that I do to help the parents, because I am a parent myself.
Right.
And I would do the same thing. I would want to know, is my child being taken care of?
Right.
And that's the main thing that they want to know. And I'll usually say, can't tell them how they're being treated, but I can say they've seen a physician,
mm-hmm.
they're being treated. And then that's it. I can't say anything else.
So it was one of the other things, I think, is since we have so many patients that are addicted to heroin or opiates and alcoholism, so obviously you have some problems with people going with withdrawal.
Yes.
From this. And so that probably in and of itself could be challenging because they become very ill.
Yes. Our doctor has a protocol. With each individual person, we call the physician, which is Dr. Voyne, and he gives specific orders for each individual person. He has a protocol that he goes by. In other words, I have medication locked up at the jail in a locked cabinet that I can, after I receive an order for him, that I can start treating them right away.
Right.
I don't have to wait until, you know, run to the pharmacy, get the medicine, and bring it back. We have it. We keep it locked up at the jail so that when we have medical emergencies like that, if somebody's withdrawing from alcohol, they're very, very sick, you know, we can start treatment right away. In fact, I had somebody I just started treating this morning. I mean, and I was able to get their medication to them in 20 minutes.
That's great. That's great.
You know, as opposed to half a day.
Right. Wait and see the doctor, and then we kind of have to, there's a delay there.
Right.
Cathy, we're almost out of time. Do appreciate you being with us. Want you to come back here soon and join us. And there's a lot of different things. You've done a good job on this interview, and I'm sure the viewers and listeners have been appreciative, because I think they've learned a lot of things about some of the things, and it's a part of the sheriff's office most people are not familiar with, and that's medical care for the prisoners.
Well, thank you. Be glad to come back.
Okay. Well, the clock on the wall says we're just about out of time. And again, I appreciate the folks here at Fairfield Christian Academy that put this program together each and every week, produce it, and with no expense to the sheriff's office or the community. And appreciate Cathy Mathias, our nurse that's been with us the last couple of weeks and provided some wonderful information. The clock on the wall says we're out of time, and do appreciate you, the viewers and listeners that join us each and every week. If you're out there driving, buckle up, and we'll see you right here next week.
smallest moments can have the biggest impact on a child's life. Take time to be a dad today.